Do you use xylitol gum?
I don't think so.
Oh my God, you have to do it.
It was on the Joe Rogan podcast. Dr. Rhonda Patrick came on there, and she shared a story about how she went to see the dentist while she was pregnant, and she found out about xylitol gum. And she had seen like, oh, there's starting to be some cavities in your mouth. She's like, well, I'm gonna try this xylitol gum thing. She did that while she was pregnant. She came back after her pregnancy, and the doctor was like, oh my gosh, your teeth look great. Those cavities are gone. And it's not that they were deep cavities or something. They were just surface level. And that's where they all start for most of us, just at the surface, right? Xylitol stimulates saliva. Saliva has minerals that can redeposit in the teeth and help start to heal those areas. So if we want to really solve the problem, it became a really great tool. But my favorite xylitol gum or mint is Epic. That's because both of those are loaded with xylitol, and you need to get enough xylitol often enough to help out. So if your partner's dealing with this, there's just a quick little thing you can do to help her teeth in the long term.
Have I told you my xylitol story? I wanted to tell you this.
Xylitol.
Do you chew gum? I know you do.
What is so good about xylitol?
So I'm going to tell you my story. When you're chewing gum or using toothpaste, many studies have shown that it kills anaerobic bacteria like Streptococcus mutans that cause cavities and dental decay. Like multiple studies in humans showing this. It's like a big deal. So I came across this xylitol toothpaste. And I was like, what is this xylitol toothpaste? So I started doing research on xylitol. And not only did I find studies that like basically kills these bacteria that cause cavities, the S mutans, pregnant women that chew xylitol gum, 6 months pregnant, the study started at 6 months, and they chewed this xylitol gum all the way up until anywhere between the baby being 6 months. And there were some studies that went out like a year. Researchers measured the oral bacteria of the toddlers, and then they measured them multiple years out as they became children. And the mothers chewing the gum, it lowered the incidence of the S mutans in the children because, you know, mothers kiss their kids and you transfer oral bacteria. And so their chewing the xylitol gum had a positive effect on the child's oral microbiome. And I was like, fuck yeah, I'm going to do this. Like I gave myself TMJ. Like I chewed so much xylitol gum while I was pregnant. And like, I still, like to this day, I chew it. I have some with me right now. But I was eating a lot of sauteed kale and chewing a lot of xylitol gum when I was pregnant. Totally fixed itself. Thankfully. A year goes by, I have my son. Eventually I'm like, okay, I got to go back to the dentist because, you know, pregnancy makes your teeth worse. So I go back to the dentist. We do the x-rays and I'm like, oh, he's going to tell me about the stupid cavities and I haven't done the research. He comes in and he goes, I've never seen this before, but your cavities are gone. And he shows the x-rays and he shows me before and after. He's like, they're totally gone. And I was like, that's amazing. I was like, is it the pregnancy? And he's like, no. He's like, we get women coming in here after pregnancy. It's like worse. And I said, the only thing that I did that I could think of is like my obsessive xylitol gum chewing, which I still do. I don't know how it would affect an already formed cavity, but my cavities are gone.
Whoa.
So,